Hey guys, my name is Andrea and the rest of our group is Kendra and Katie. We decided to do our presentation on Hmong culture and their birth practices. We hope you enjoy this presentation. The Hmong people continue to reside in the mountainous regions of Vietnam, Laos, Thailand, and China. You can see looking at the map I put the red dots. There's about 4 to 5 million Hmong, with 3 million of them residing in China. They are sometimes called Mao due to ethnic classification created by the Chinese government. It is known that during the Vietnam War, the Hmong people helped U.S. soldiers against the Laos communist regime and were then targeted by their government, causing them to flee to refugee camps in Thailand. The United States also accepted many Hmong refugees as citizens, and there's an estimated 200,000 to 300,000 living in the United States today. California, Minnesota, Wisconsin, and North Carolina, as you can see on the map, have the most heaviest population of Hmong among the rest of the states. Many Hmong speak the language from their country they emigrated from. About 60% of them living in the United States today speak fluent English. Hmong political organization, there is no political organization above the village level, traditionally organized into clans that are based on common ancestry. The leaders of these clans are appointed by elders or elected by his clansmen. Some of the qualifications would be he must have extensive knowledge of various aspects in Hmong culture. He is referred to as the one who leads to eat and to do. And a man between 30 to 50 years old is ideal. The Hmong believe young leaders are not mentally strong and do not elect the very old. Clan's main function is to provide social support, legal authority, and economic security. Political power is decentralized. Localities have a large say in legal matters, though the clan leader has the final say. Each Hmong answers to their family, clan, and householder. In family matters, the Tuson Nug, I don't know if I'm pronouncing that correctly, which is considered the householder, has the final say on a local level. The patrilineal system, meaning the Hmong join their father's clan, it is forbidden to date or marry within the clan. When women marry outside the clan, they are then considered part of their new husband's political clan. Women's role are to steer clear of politics. Though Hmong women were always taught to steer clear of any kind of political organizations, in the United States, a woman named Mawa became a political leader. She became a senator in 2002 of Minnesota State. It was the first time a Hmong was elected to become part of the American state legislature, but equally amazing that she's also a female and strongly supported by her people. As the state senator of Minnesota, May represents the east side of St. Paul, which is a district with a large Hmong population. May was also born in Laos during a time where there was a lot of conflict after the war, and she and her family fled to Thailand when she was just 5 years old. In 1978, her family, among many other Hmong refugees, moved to the United States. Here's some more information on social organization of the Hmong culture. It kind of goes with our political organization slide, but the central unit of any political or social organization in Hmong communities is their clan. Clans are determined by ancestral lineage, which traditional ceremonies they practice. Hmong families tend to be large and extended. Family is the clan. The Hmong men stay within the same clan for the rest of their life, but like in the previous slide, once a woman is married, she becomes part of her husband's clan. Each clan has a leader. The leader must be considered honest, respectful, and capable of making wise decisions. The leader of the clan help make important decisions such as illness, divorce, and death in the family. And the leader is also responsible in making the decision if someone should possibly need surgery or whether the patient should be resuscitated or not. Gender roles of the Hmong people. Hmong men tend to have superior status. The boys are considered more valuable, so they get more educational opportunities. The men make the rules and the women follow them. The men are the clan leaders and head of the families. They make all the big decisions. Sons are valuable assets to a family because they are the ones who will carry on the clan name and are expected to take care of their parents in their old age. Hmong men should be strong and never show emotion. He is never at fault and he is always right. A man's needs are above that of a woman. And a Hmong woman has lower status, head of house chores. She takes care of the men and bears the children. She does not go to school or hold a job outside of the home. Daughters are not desirable because once married they belong to their husband and take on his clan name. Women are considered property of their husbands. Thus, there is a general lack of respect for women and their opinions. Hmong women should be submissive and listen to their husband. In order to control the wife, Hmong men may resort to domestic violence. Education. Buddhist monks provided most of the education to young men in Laos. Traditionally, up until the mid-20th century, the education that was provided were the principles of Buddhism. Monks typically lived in rural mountainous areas, so schools were not easily accessible for them. If Hmong children did attend school, they were not taught the Hmong language, only in Laos, Chinese, Vietnamese, or based on where they were living at the time. Typically, the young boys were able to go to school, but the young girls had to help at home and watch over the younger siblings. Here is a list of some of the traditional religious views of the Hmong people. Most Hmong are animists, meaning they believe that objects, places, and creatures all possess a distinct spiritual essence. The belief that the spiritual world coexists with the physical world, which would umbrella over ancestral spirits, house spirits, spirits in nature and objects, and evil spirits. Like other religions, Hmong acknowledge a righteous, supreme, natural being. They believe in life after death. The souls of the deceased will come back to their ancestors for reincarnation, and that their new bodies of the relatives will come back as a new member of the Hmong families. Hmong practices include shamanism. A shaman is a person who acts intermediary between natural and supernatural worlds, using magic to cure illness, foretell the future, and control spiritual forces. This is among one of the ancient traditions and a way of life for the Hmong people. Here are some cultural considerations of personal space. Older men of Hmong culture may tend to use metaphors to express themselves. This could make it difficult for healthcare providers in the United States. Usually, Hmong women who are close to each other will greet each other with a hug. Traditionally, looking directly into someone's eyes is considered disrespectful. When in a hospital setting, Hmong may listen attentively but avoid eye contact. Hmong may not communicate dissatisfaction with the care that they are receiving at the hospital because they may not feel comfortable enough to speak up about it. It is considered inappropriate for opposite genders to sit closely to one another when conversing in public. The oldest man receives the most respect and should be spoken to first when greeting each other. And traditionally, Hmong elders do not want strangers touching their heads or their children's heads due to religious beliefs. Hmong's orientation to time are typically in present. They usually do not look into the future for healthcare. Many Hmong tend to relate time as a cyclical and slow and advancing. Most will show up to events late unless specified that being on time is important. Healthcare appointments would need to be written and explained thoroughly, and provided extra time for consent to be signed for any procedures because it may involve speaking with their elders to make that decision. Biological variations. Among the Hmong population, some health disparities include tuberculosis, diabetes, cancer, gout, hypertension, kidney failure, measles, COPD, and stroke. Reportedly, cancer mortality is higher among Hmong than other Asian American counterparts. Mortality rates for cervical and liver cancer is 3 to 4 times higher in Hmong than Asian Americans. Hmong have also been proven to have higher uric acid levels compared to non-Hmong patients. Many Hmong migrated to the United States with intestinal parasites, depression, PTSD, and anemia, and older refugees may show signs of malnutrition, yellow rain exposure, and other war zone chemicals. Some cultural factors affecting healthcare among the Hmong culture would be the role of the family plays. The men make the medical decisions. The elderly are turned to for wisdom, and elder women normally help with home births. Usually there is a family member who specializes in healing herbs. Hmong recognize illnesses can be a result of external natural forces. Other causes could be from metaphysical imbalance, weather, stress, hostile spirits, or spells. Ill health may be the result of the soul wandering from the body. They use religious prayer and home remedies to seek out healing. And for more serious problems, they might seek out a shaman. There is also some lack of knowledge about healthcare systems and isolation from medical facilities and big cities. And sometimes there's also the fear of embarrassment, pain, harmful subpar care, or a lack of respect by healthcare providers for their culture, including their beliefs about health and illness. Here are some Western medical practices that may conflict with the traditional Hmong belief system. Surgery. Many Hmong believe that surgery may interfere with reincarnation after they die, and or surgery may open access to the body for evil spirits to enter. Drawing blood. Many Hmong feel that blood maintains balance in the body and that withdrawing the blood will weaken the body. And then autopsies. Traditionally, Hmong believe that an autopsy on a deceased person may hinder reincarnation. For this reason, many Hmong believe they will have portrayed a family member if they allow an autopsy to be performed. Hmong also believe it is disrespectful to allow the body of their relative to be dissected. Here are some traditional views of health prevention, maintenance, and illness of the Hmong culture. Health management and promotion are not well received because the Hmong culture is considered oriented to the present and not based in the future. Medications are expected to have an immediate effect. If they feel that the effect is undetected after a few doses, they will stop the medication altogether. Many patients will refuse invasive procedures, which would also include sometimes blood sticks for labs. They have strong beliefs that illnesses are the results of spiritual influences and medical interventions is not necessary. Smoking is primarily for ceremonial purposes. They may hesitate to report constipation as a health problem. Due to the wars and violence, refugees for many generations may suffer from PTSD and or result in suicide. Mental illness is viewed as the person communicating with different spiritual influences. Mental illness is treated by an animal sacrifice, followed by a ceremony during which the animal is eaten. It is believed that this removes the evil influences from within them. Very common not to express pain, but will accept pain medication if given a good reason for it. It is common to make animal sacrifices to aid in healing. Some sew parts of the animals into clothing and wear them to help promote healing. Often amulets or religious jewelry is worn to help protect against evil spirits. Elder Hmong focus on treating illness when it occurs and not from the beginning and preventing it. cultural beliefs about the privacy of body parts and the common practice of women deferring to their husbands. Will seek care from shamans, like the previous slide, for physical, emotional, and psychological complaints as well as health information. Access to health care. Hmong tend to be perceived as reactive versus proactive in seeking help when they need it most. Hmong residents utilize both Western and traditional medicine due to lack of complete trust in Western medicine. Language access and lack of cultural competence are their concerns when receiving care. When Hmong arrived to the United States, they did receive some financial assistance and access to Medicaid, but only temporarily. Many Hmong typically resort to healing practices such as shamanism and soul calling as the first step of preventing illness. This is still practiced in the United States today, delaying them from seeking Western modes of medical services. Research has also shown that ethnic minorities are at the most increased risk to cancer or cancer-related death. Some economic barriers would be underinsured or uninsured. Although many Hmong may have Medicaid, it has been proven that if they have access to private insurance, they tend to receive preventative care. Linguistic barriers, lack of proficiency in English, lack of trained medical interpreters, and lack of medical terms in their language. Some cultural barriers would be the lack of knowledge in the Western healthcare delivery system and skepticism of Western medicine. Access to prenatal care. In Laos, pregnancy was not noticed until 4 to 5 months. When Hmong migrated to the United States, they realized that it is expected for them to get prenatal care early and very often. The women were uncomfortable with cervical checks and other prenatal procedures, which led them to receive care late in their pregnancies. When Hmong began to arrive in Minnesota at the time of delivery of the baby, there were no access to Hmong interpreters in the hospital to convey the mother's need. Currently, there are patient navigation services available in the hospital setting to help with education, but the services are limited to the Hmong population. Here are some birthing practices and beliefs of the Hmong women. For pregnancy, some women believe that conception occurs only when the egg and the seed are equal in strength. Another level of belief is that conception requires more than these biological joinings, but the need of connection to the spiritual world, where spiritual parents give permission to the soul awaiting to be born in a woman who has the right to be a mother. Women believe they are not to work too hard or to carry heavy loads, which can cause disconnection of the placenta and a miscarriage. Women are not to cross rivers, low valleys, or wander into inhabited areas. This can leave them susceptible to evil spirits, which can also cause miscarriage. It is believed that during early pregnancy, the baby stays in the upright position until later in the pregnancy, the baby will turn upside down. If a woman falls early in her pregnancy, the baby would then turn upside down, causing the baby's organs to collapse. During pregnancy, women are allowed to practice sexual intercourse since it does not have an impact on the baby. For childbirth, only women may be present during the birthing process. The only man allowed is the husband. Men who have experienced more than one child are able to cut the umbilical cord, bury the afterbirth and placenta, wash a newborn, and prepare the confinement space for their wives. Women like to give birth by themselves. Most women are embarrassed if their husbands are too close. Only old women are allowed to check the woman's body when it is absolutely necessary, which would be prolonged labor or breech birth. Hmong women traditionally give birth in the kneeling position on the floor where soft cloths are laid. She may then sit upon a stool between contractions for rest. Birth is to take place in the husband's home. It is prohibited to give birth in the woman's natal home. It is thought to cause the clan spirits to weaken, which is known to lead to misfortune and illness. Postpartum for Hmong women also can be referred to the 30 days of confinement. After birth begins the 30 days of confinement. Women sleep on straw beds in front of a fireplace for the first 3 days after birth. The the belief that mom and baby need to be kept warm, further preventing illnesses. The straw absorbs blood from childbirth and after and must be burnt on the third morning. Leaving the straw can attract evil spirits, leading the woman to be struck by them. Women practice abdominal binding postpartum to help bring her abdomen back to its normal shape. Hot food is only to be consumed during this confinement. As from the previous slide, chicken soup and hot rice is their main food source during these 30 days. The green herbs serve multiple purposes. They help rid the body of leftover childbirth, placenta, and replace energy, enhance breast milk, improve appetite, and releases aches and pains. Cold food and drink is seen to cause the body to clot. Ice and cold water are believed to cause death. Massage is another technique used to help rid the body of leftover blood or placenta. Other pregnant women and lactating mothers and their husbands are prohibited from visiting during confinement. This can cause cessation of breast milk in new mothers. Combing hair is seen as a hard physical activity and is prohibited, and sexual intercourse before the end of 30 days can cause prolapsed uterus. Here are some Hmong birth practices. Hmong believe a person is connected to the placenta for life. So following birth, Hmong traditionally bury the placenta. Traditionally, the placenta of a boy is buried beneath the main post of the house since it's considered the connecting link to the ancestral spirits, and a son is responsible for the spiritual obligations of the lineage. The placenta of a girl is traditionally buried under the parent's bed. Hmong believe that at the time of death, the deceased collects the birth shirt, which is the placenta, at the birthplace, and with the proper performance of rituals, the soul can find its way to the land of darkness and eventual rebirth back onto earth. On the third day after birth, a soul calling and naming ceremony is held. Hmong do not believe that the child is truly a person with a full complement of souls until their ceremony is held. Traditionally, Hmong believe the new mother should stay at home and rest with the newborn child for 30 days following a birth. Hmong believe that the new mother should follow a special postpartum diet in the 30 days post-birth period. This diet includes hot foods opposed to cold. Hot foods in the postpartum diet include fresh hot rice and chicken boiled with fresh green herbs. The husband and or the mother-in-law will often cook these foods for the new mother. And the new mother and child are not encouraged to visit other households, and in Southeast Asia, Hmong may place a taboo sign outside of the home to warn others of the status of the mother and the newborn. Social and religious factors affecting Hmong birth practices. Hmong women prefer following their cultural beliefs and practices in taking care of themselves and their babies. Traditionally, women are encouraged not to tell others about their pregnancy due to a fear of evil spirits affecting the child. Therefore, is a reason why Hmong women do not seek prenatal care. The placenta is required for reincarnation. Vaginal examinations may not be available. If they are available, Hmong women refuse male help. Hmong women trust themselves, their bodies, their supportive families, traditional Hmong practices, and household spirits to ensure a healthy home birth. Hmong seek a shaman for help first, not medical professionals. Hmong women want a home delivery in presence of ancestral household spirits. Women are in a position with no authority to make decisions. The Hmong culture represents many barriers due to the patriarchal dominance of the relationship and the family clan structure hierarchy. Seeking medical help is disliked and perceived as painful, embarrassing, and harmful. Some missteps that may occur with the Hmong culture would be that they may not communicate dissatisfaction with their care. They may feel uncomfortable speaking up and choose to go elsewhere for their care. Even when listening intently to providers, they often avoid direct eye contact because they consider it rude. Providers need to be aware of their nonverbal cues because they might interpret what they are saying through body language. Do not like ice in their drinks. Their health is treated with warm-hot diet. The expectation of medication having an instant effect might lead to noncompliance. Needs more health education. Some practice folk medicine such as coining, cupping, and pinching can be mistaken as child abuse. It is common for Hmong families to take care of their elders at home rather than staying at a nursing home. It is important for healthcare providers to understand that younger Hmong must show respect for their opinions of Hmong elders to maintain familial harmony. Conclusion. Delivering culturally relevant and appropriate health care, especially nursing care, during the prenatal period might be difficult if tradition, beliefs, and customs of childbirth of the Hmong women are not recognized and understood. It is important for nurses to understand Hmong tradition before explaining the reasons for Western medicine, while remaining culturally sensitive. For nurses who work in significant populations of Hmong Americans, including North Carolina, targeting culturally tailored practices to include Western and traditional herbal Hmong healing practices show the greatest promise of providing high-quality, culturally appropriate care. We chose the following references due to their reliability and credibility. They are peer-reviewed and provide evidence with qualitative and quantitative research.